Hi, welcome to the clinic. My name is Michael. I will be your therapist today. How can I help you? Well, let me start by saying that we do two treatments here. We do your traditional Swedish, which is if you have any body pains or aches or sprains or strains. Do you have any of those? No. So what exactly are you feeling? Oh, you're feeling tired. You're feeling fatigue. And you don't quite understand why. Well, can I make a suggestion? How about having an Asian treatment? You never had one before? It's okay. It's pretty easy. You've gotten Swedish before, right? Yeah. Oh, well, there's a couple of differences. The main difference is you don't have to take your clothes off for Asian. So I know that people that have issues with their body or just feeling like, hey, who's this guy touching me? You don't have to feel weird. So you get to keep your clothes on. And it does kind of hurt a little bit, but in a good way. I'm not gonna lie, it can be a little painful, depending on what's going on with you. You're actually a new patient. Thank you for coming. Did you find out about this place? Oh yeah, she's awesome. She recommended you? I'll have to thank her when she comes in next time. Alright, well, let's start with the basics. Your name. Your age. You single, married, divorced? Just kidding. Single. Awesome. Your occupation. Yeah, there's a lot of questions on this thing. It's going to take a little time, but after I take all of this and then you keep coming back, this will be so much easier. At least for your treatment, things like that. So, your height, your weight. Come on, it's not true. You're lighter than that. Your chief complaint. Feeling fatigue, tired, and upper back pain. That's cool. I mean, not cool that you have pain and fatigue, but these are things that we can help. Is there like an onset? Like what triggers these things? Yeah, I know work sucks. Holidays, oh man. I know. There's a lot of stress going on right now. Any provocations? What makes it feel better? What makes it feel worse? Let's start with better. Hey, whatever gets you through the day, right? Sunday it'll be legal. And what makes it worse? Yeah, lifting things probably would make it worse. And not sleeping through the night. Heavy drinking. Oh, okay, cool. The quality of pain. Let's say acute, subacute, chronic. Basically, if it's acute, it started right away, like this morning. Subacute, you've been dealing with it for like a week. Chronic, it's just subacute. Radiation. Does this pain travel anywhere? Down your arm, perhaps? I mean, there's trigger points and things like that. It'll be like, oh, I hate when that happens. It goes down my arm. That's when you know it's true pain. True trigger point. It doesn't. Oh, bad is this pain? It's not bad for some of the points that I would be pressing are gonna be like a 7. As long as it doesn't go over a 7, it's tolerable. Time of the day that you feel it the most. Yeah. Good. Okay. Let's talk about your medical history. Do you have any illnesses, surgeries, treatments that I should know about? None. Okay. Great. Family medical history. Let's talk about your mother. Oh, that's good. Just high blood pressure. Does your mom eat a lot of greasy food? Oh, she likes her grease, huh? Let's go. What are you gonna do? Father. Great. Are you on any medication or supplements that I should know about? Allergies, Tylenols, ibuprofens. These things do cause extra bruising. So if you do have any, or if you're taking any, you should let me know. No, just those natural things. Okay, cool. Let's go on about your diet. Like I said, I know there's a lot of stuff here. It's kind of in depth, but we need to know all these things to properly treat you. So, coffee. How many do you have a day? I know. Oh my goodness. A day. Okay. We should probably bring that down a little bit. I know that it's hard, but decaf. What's decaf, you say? That's just coffee without caffeine. Oh, you're being funny. So no. Regular tea? There's a lot of caffeine in that. None of that. Okay. I guess no decaf tea. Herbal teas? Herbal without the tea. Nope. Well, how many times a day do you do that? Okay, well, it's not bad. Soda. Only diet soda. That's a lot of diet soda. I won't even go into what's in there, but you gotta keep your figure, right? Fruit juice. Yeah, juice. Once. Okay. Alright. Now, the big thing, water. How much water do you have a day? Tap, bottle, I don't care. Oh. Alright. You should definitely have more water. I can't prescribe you anything except some advice, and that's definitely drink a lot of water. I mean, fatigue and all that dampness in your body is probably because you don't have enough water and too much coffee. That's already kind of what my assessment is. Cigarettes. Do you smoke cigarettes? No. Okay. Pretty awesome. Milk. Cheese. Yogurt. Oh, that's good. Yogurt is good. There's a lot of probiotics and a lot of things. Move stuff around. Ice cream. White sugar. Candy. Oh. Wow. That's a pretty good amount of candy. Salt. Yes. Pepper. Yes. Chocolate. How much chocolate do you have a day? That's good. Artificial sweeteners. Cake and cookies. Fried foods. Oh, here we go. Okay. White bread. grain bread, whole grains. That's good. Nuts and seeds. Pasta. Canned food. We've all been there. Fresh veggies. Come on, give me a good number. That's pretty good. What do you shop at Trader Joe's or something? They got some good produce there. Alright, let's get into the meats. Veal. What's veal? Good answer. Pork. Pork. Okay, shellfish. Beef. Chicken. Who doesn't love chicken? Deli meats. Fresh fish. Canned tuna. Fresh fruit. I figured to be almost like as much as your veggie intake. Oatmeal. Pizza. We're in New York. Gotta have pizza, right? Bagels. Chips. Salt. Peppers. Like green peppers, yellow peppers, red peppers. They're considered nightshades. I don't know. You don't have any anyways. Eggplant? Nope. Potato. Potatoes, man. It's like my curse. Tomatoes. Eggs. Soups. Low-fat milk. Okay, cool. Now, how about alcohol per day? Let's see. And a type. Are you a wine person? Yeah. Red is good. Moscato. Rosé. Melback. Alright. You like your wines. Alright, well, let me see. I'm gonna ask you to stand up now for me. I need to check your posture. There's usually like a plumb line. You stand, your ears touch there. Let's go straight. You have some slightly elevated shoulders. I believe you have some sort of tension there. Do you work out? That's the next question. I'm not just being... Okay. Damn. Well, that explains a lot of the tension. What do you do? Like, what type of working out? Vigorous, like weightlifting, cardio? Are you doing like T25 or P90X3? I think they're up to now. Oh, T25. How does that? Hard to the joints, I bet. I have actually a few people coming in here because they do T25 and they don't stretch enough for those exercises. Alright, now I need to check your pulses. I know, it's kind of weird. Let me explain how this works. Both sides have different meanings of pulses. I know in Western society we believe that we only have our radial pulse, which is fine. I mean, you got a good pulse, it's high, you have blood pressure, it's low, you got low blood pressure. In the Eastern medicine, your left hand pertains, see, 3, 1, 2, 3. Your top one right here This is your heart. This is your liver. And this is your kidney. You have your right side. This is your lung. This is your spleen. And this is your kidney. So let's check your left first. Can I have your right, please? I'll explain to you after everything is done how you're turning out. So far, so good. Now comes the weird part of our assessment here. Basically, the window to your internal organs are in your tongue. I mean, it's basically an extension of your body coming out of your mouth. So you could tell a lot by like lip complexion. Like my lips are dry. I haven't had enough water today. Obviously I've been working all day. I feel that sometimes with doing this job, I give my chi out and my essence is given to people like yourself. And I know that every time I'm done working, I have to rebuild my chi and stretch it out and just throw it all away and not even think about it, because if I took home everybody else's problems, I'd be in a lot of pain. But like I said, I'm gonna have to see your tongue. Yup. I know you just had coffee. You had so much this in a week. I would only imagine that you had about 2 cups already. It's okay. I've seen pretty weird looking tongues. Alright. Let's see. Oh, don't be shy. Unless your tongue is that short, then that's another tell. Oh, I knew you had more tongue in that. Let's see, what do we got here? So, I'm going to draw your tongue. So I can explain to you. So, you probably can't even see that because I can't see that. So your tongue, I'll stick my tongue out, why not? You have the tip, which is your heart. You have the sides. The sides are considered your gallbladder and liver. The middle is your spleen and stomach. And for the most part, everybody's tongue is the same, which is, like yourself, the sides are scalloped, which means your tongue is kind of big, and your teeth are kind of leaving it with like these little edges on it, and that means you have an excess amount of fluid, and you have dampness in your gallbladder and your liver, and you have also a vertical crack down the tip of your tongue, down your tongue, crack. Now that's pretty much saying that you have a spleen chi deficiency, and you have a red tip tongue, which means there's some stagnation of heat, or you have an excess amount of yang, which is pretty normal. So, what does any of that mean? Well, I'm gonna tell you, you have, your tongue is heat, so you must have an excess amount of yang. So, you probably have you have a sticky tongue coating as well. I'm sure you feel heaviness in your body, like the fatigue feeling. And your spleen G deficiency, do you by any chance sing your thoughts? Yeah, that's one of the spleen G things. You worry a lot, pensiveness, have trouble sleeping. Yeah, those are other things. Your voice is really low as well. You have a really low voice, which is weird because with the red tip tongue, it's usually an excess yang, which is like loud and robust. So I'm guessing when somebody pisses you off, you are gonna go off. But in your normal everyday, it's the weak voice. So that is also a spleen G deficiency. I can go over your pulses, but let's see. Let me just explain your pulse and your tongue. So you had the vertical crack, which means you have a spleen, stomach area, scalloped around the liver, gallbladder area, and you have a thick coating. I'm guessing of cream or milk, and you have a red tip tongue. Your pulse, you had a rapid lung and floating. Spleen was sinking, dry, and your kidneys was slippery. Your heart was rapid and floaty, liver was floating, kidney was wiry, and that means that your liver and gallbladder are in disharmony. So what does that mean for me to do for you? Well, I'm gonna basically focus on tonifying the spleen. I'm gonna resolve the dampness. I'm gonna clear any stagnation. And I'm gonna be focusing on your gallbladder, spleen, lung, large intestine, and your CV channel, which is your an extraordinary meridian. It's like your CV is like the middle of your body, and it goes to like your genitals and things like that. So it's like really extraordinary in layman's term. So I guess you want an assessment of your pulse. Well, you have internal heat in your lung. You have spleen is deficient. Your kidneys are damp. With a blood or G deficiency, your heart has an external wind heat, so it's coming from outside. Your liver has damp heat, which indicates that you have a disharmony in your gallbladder and liver. I know it's a lot to take in, but you're in good hands. Trust me. So, like I said, I'm going to remove any stagnation from your shoulder and upper back. Tonify the spleen, resolve dampness, and I'm going to relax your sinews, your tendons, treat any painful obstruction syndrome around your neck, shoulder, and I will expel that wind heat. Yeah, it sounds pretty cool, right? But not yet. I still have to keep taking more of these intakes. That was a long time. Okay. So, let's continue, shall we? I need to touch your skin. It's normal. Can I touch your palms? I'm just checking for the heat and sweat. Sweaty. Did you come from the gym or something? No? Okay. It's not too bad. I know these questions can get a little personal, but I need to know about your digestion. gassy? Are you bloated? Do you have loose stools, hard stool, normal stool? Okay, well, that's always a good thing to know. Do you have any mucus, acid reflux that I should know about? Do you burp a lot? You do. Is it loud? That's rebellious chi. Your chi is rebelling against itself in your stomach and comes out in a burp. It happens. We could resolve that. Your urination. I need to know the frequency, the color. Is there any pain when you pee? No. How many times do you pee at night? Like while you're in bed, get up. Actually, physically have to get up to go to the bathroom. Okay. Any weird orders? Okay. Pain. Like, do you have any headaches? Yeah. Life. No. Joint, back, neck. Does the weather make you feel? Just give me 1 second. Not what I was looking for. I will find you. Interesting. Oh well. Sorry. What's your favorite season? Mine too. Your least favorite? It's mine too. This is pretty insane. It's gonna be pretty easy to treat you. So, like the same things going on here. Let's talk about your sleep patterns. You have insomnia, stress. How do you find yourself falling asleep? What is that? Asthma? ASMR. Okay, it sounds pretty cool. Is that like a pill or something? Oh, that's that new thing people are talking about. I've seen people talk about it on TV, saying that a generation of people putting other people to sleep. I'll have to check it out though. ASMR. Interesting. Cool. Do you have any problems in your chest? Any shortness of breath, coughing, asthma, wheezing? Good. How about your eyes? Your eyes blurry vision. Do you have floaters? Those little squiggly lines in your eye. You do? A lot? No? Okay. Any redness? Only after you partake in that stuff, I bet. Itchy, dry eyes? Dry eyes? No. Okay. You use Visine, I'm guessing. Yeah. Okay, let's go. Ears, do you have any heat, discharge, ringing? You have heat. You know, sometimes I feel like when my ears are hot, I feel like somebody's talking about me. But I'm sure there's some sort of weird neurological thing happening there. Let me ask you something. When you partake in your, I don't know what you would call it, your activities, do they burn more after, or they do? It's probably your neighbors saying, damn, shut it down. No, but I always feel like if my left ear is like ringing or burning, it's like good, and when my right ear is ringing, it's like bad. I don't know. But I could be wrong. I could be totally wrong. Anyway, let's get back to it. Nose, discharging, color, onset, any postnasal drip. You have allergies? Oh man, it's terrible. Picking up that. Throat, is it sore, scratchy, dry? And your mouth appetite. You have teeth pain, gum pain. No. Okay, that's good. How's your menstruation? I know it's a strange question, but if there's a stagnation, it's probably going to appear in this question. So, oh man, I'm sorry to hear that. PMS. Heavy. Irritable. Outright lash out on people. Cool. Don't come around here those times. Now, that's probably... I didn't look under your tongue. Can I see that? Yeah. It's really purple. You probably have like blood stagnation, which is probably pertaining to the spleen tree deficiency that you have. Spleen governs blood. It's the commander of blood. It says, go do your job. Or it turns water into substance like nutrients. That's why it's also the chief of the muscles. So if you got weak muscles, or you're used to having really strong muscles, and I don't know, you're like, damn, I'm feeling a little light here. It's probably a spleen tree deficiency. Anyway, let's go back. Stress. It's from 1 to 10 stress. Fatigue from 1 to 10. Okay. What is your dominant emotion? That's nice. People like positive people. I think positivity brings out positive in everyone, and we should all be very positive. Any dizziness? You say you have regular blood pressure, right? Oh man. Sometimes you get vertigo. Have you ever been, I don't want to go off topic, but have you ever gotten tested for lupus? No. Well, I won't get into the clinical things about lupus, but your gender is definitely in the higher population of having it, and you should probably get that checked out, because vertigo and dizziness are nothing to be played with. That's just me being friendly advice. Don't find out down the road. Is there any other questions that you want to know about yourself, or do you have any other thing that you want to tell me about? Like any other personal pain before I start doing things and stuff that comes out? Right. Let me see. Don't worry, we're gonna... All this is confidential. I don't want to ever know about this. We're gonna take good care of you. I'm gonna take good care of you. I think we have everything that we need here. Like I said, I'm going to be working your kidneys, your gallbladder, your spleen, your liver, and all the pain around your back and your head and the stress. With the grace of the powers of healing in my hands, I will make sure to get rid of them. So you ready? I'm gonna leave the room. I'm gonna lower the lights. And I want you to just lay there, face up. And I want you to really think about your body. And I want you to really visualize things moving. I want you to visualize your blood transporting through your body, healthy. I want you to imagine blood going down your arms, nourishing your limb, coming back toward the heart, and back out, go down your other limb, come back together, down your legs, to your toes, calves, your thighs,